Our healthcare system is broken at this time.
The inability of young people to have adequate coverage.
I'm a school teacher, so I see a lot of the kids and younger parents that have no care.
The inability of older people to meet the increased cost of medical expenses.
People can't afford their drugs that they have to take.
The people who need it don't have it. They have no opportunity for care. That's wrong.
When I sit down with a patient in the office, I have to consider what their insurance status is when I decide how to treat them.
The need for a plan that has specifics in it is clear.
People are worried about a lot of different things. There are millions of people who don't have any coverage, and they're just frightened every day they're going to get sick or have a serious health care problem. Many more than that have their health care coverage, but the cost is going up. You know, their premiums are just going up year after year after year, so they're worried about how they're going to pay for it. They're worried if they change jobs, they lose their health care coverage. They're worried if they change jobs and they have a pre-existing condition, if they have a heart condition or one of their children has a health problem, that it won't be covered. People are worried about their own individual circumstances, which is understandable. For the country as a whole, what's good about my plan is it brings down healthcare costs. We've got cost containment in a lot of different ways. Lower administrative costs, better use of technology, making sure that we use the most cost-effective drugs and treatments that are available. There's just a systematic approach that doesn't exist today.
I'm actually very proud of the fact that I was the first presidential candidate to lay out a detailed, substantive, truly universal health care plan.
When you say everything's covered, is there, deductibles, co-pays in your plan?
Yes, there are deductibles, there are co-pays, and they are dependent on your income level. But basically, there are going to be choices available. There will be efficiencies created that don't exist in our healthcare system today. We're going to dramatically lower administrative costs. The government plays a very important role. The government will set up healthcare markets around the country. In each of these healthcare markets, a number of things will be accomplished. First, there'll be choices from which people can choose the healthcare plan that they want. Some of the choices are private insurers. One of the choices will be the government. It'll be something similar to Medicare. If you have your health coverage in one of these health markets, then you can either leave your job or go to a different job and keep the health care that you've got. There will be an enormous benefit from people having health care from the time they're born until the time they die. And that includes preventative care. Because one of the things that motivates me is that we have 37 million people who live in poverty. And I think every single American has equal worth. And I don't think we should treat anybody as better than anybody else. That's the heart and soul of who we are in this country.
I keep hearing people describe me as a populist. If being a populist means you feel deeply and strongly committed to regular people having a real chance and not getting run over by big, powerful interests, oh yeah. If that's true, I'm a populist.
He wants to be president for everybody.
And he speaks with a sensitivity and a concern for the country and the people in the country especially.
Can we finally say we stand now and forever for every single man, woman, and child in America having health care, universal health care? We will leave no one behind. We will not allow a single family or a single child in America to not have health care coverage and to not have the health care that they need and deserve.
I think what America really wants in their next president is to be able to trust their president. And in order for that to be true, they want to feel like, even though the president's faced with very difficult challenges, that he is a good and decent and honest human being who's trying to do what's right.
John Edwards came out and said, I'm for universal health care, and this is how we're going to do it.
I think he'd be a people's president. Health care to everybody that needs it.
Tomorrow begins today. We can take responsibility for this country today. We can take action today, because somewhere in America, everywhere in America, people are counting on us to stand up for them.
Somebody asked him, why is this campaign going to be different? And his answer was, because everybody in the country is going to know precisely where I stand. This, to me, is an honesty that I haven't heard in a long time.
I'm proud to be the first major candidate with a plan for true universal health care. My plan would save an average family $2,000 to $2,500 a year and eliminate at least $130 billion a year in wasteful health care spending. Under my plan, the government sets up health care markets around the country to give people a choice of good health care plans, including a choice between private and government plans. It creates efficiencies by dramatically lowering administrative costs. And then we'll fill in the deficiencies that exist in today's system. No more pre-existing conditions. Mental health will be treated exactly the same as physical health. Preventive care, chronic care, long-term care, all will be covered. Subsidize health care for all low-income families and provide subsidies for middle-income families. I'll create an objective source of reliable information and help doctors adopt the best practices to ensure their patients are getting the most effective care. My plan will require by law that every man, woman, and child in America be covered.
I'm John Edwards, and I approve this message.